This is Dr. Gail Eberharder. I am a functional medicine physician and acupuncturist practicing medicine in Boise, Idaho for over 30 years. I became certified in functional medicine through the Institute for Functional Medicine in 2013. Our clinic offers group visits to educate our patients, and we are expanding availability to our website. Thanks for joining us. Today, our topic is female hormone issues prior to menopause. This will include fibroid tumors, endometriosis, premenstrual syndrome, and polycystic ovary syndrome. We will be discussing estrogen, progesterone, and testosterone. Estrogen is made in the ovaries, adrenal glands, fibroid tumors, and abdominal fat. It is a very inflammatory hormone and stimulates all estrogen-responsive tissue. This includes the breasts, the uterine lining, the ovaries, and vagina. Stress will also increase production of estrogen. Progesterone is made in the ovaries and adrenal glands. It causes the starting and stopping of menstrual flow. If your menstrual cycles start to be closer together or further apart than about 26 to 30 days, you are probably low on progesterone. Progesterone is also calming and anti-inflammatory. It can be made into cortisol, testosterone, or estrogen, so it's really a precursor hormone. Because progesterone can be made into cortisol, we see women under stress have lower progesterone levels. This is because progesterone is diverted to help make cortisol, which is the body's anti-stress hormone. Testosterone. This is also made in the ovaries and the adrenal glands from DHEA. It is the source of libido, hair growth, and muscle in both men and women. Many women come in asking for more estrogen when their libido is low, but they are actually low in testosterone. Testosterone requires progesterone as a precursor, and because it is made from progesterone, it can also be low due to high stress. Progesterone again getting diverted to make cortisol in response to the stress. This is the dreaded steroid hormone chart where we can see the relationships between the hormones, as I mentioned previously. On the far left, third from the top, is progesterone. The arrow 1 molecule to the right and 2 down shows the path to making cortisol. The arrows 2 to the right and 1 down from progesterone shows the path to making testosterone. Stress is the enemy of libido and regular cycles. It also contributes to PMS from decreasing progesterone as well. Estradiol, the strongest estrogen, is seen at the bottom of the fourth column. Next, I want to talk about the aromatase enzyme. This enzyme is the cause of too much estrogen and contributes to imbalances between estrogen, progesterone, and testosterone. It is turned on genetically for some women and also by fat, stress, and elevated insulin from too much glucose in our blood. It lowers testosterone by converting it to estrogen. This is the cause of fibroid tumors in the uterus, PMS, fatigue, and muscle loss as we age. This image shows how the aromatase enzyme increasing estrogen is part of a cycle that just builds on itself. We will be looking at all the places we can stop this vicious cycle of increasing estrogen as we go through our talk. We have heard about aromatase. COX-2 or cyclooxygenase 2 enzymes increase inflammatory molecules that fuel this cycle also. They take compounds from animal fats and convert them into prostaglandins such as PGE2 that again stimulate the aromatase enzymes. Next, I would like to look at some examples of how this affects different women depending on their genes, diet, and lifestyle. Fibroid tumors are benign, smooth muscle tumors in the wall of the uterus. They can become quite large and cause problems by pressing on the bladder, ureters, and colon. They can also cause pain and discomfort. Fibroids are estrogen dependent and also make estrogen. Fibroids have the aromatase enzyme in them to convert testosterone into estrogen. They are part of the vicious cycle of estrogen causing more inflammation, which causes more weight gain and more estrogen. Stress worsens this cycle, causing increased DHEA. We must use caution in adding the DHEA and testosterone hormones for women because they can cause growth of fibroids by actually increasing estrogen. Next, I want to discuss endometriosis, or abnormal uterine glands. Endometriosis refers to uterine glands that are outside the uterus where they should not be. These may be around the ovaries or just in the pelvic cavity itself. This can cause significant pain, especially before the menstrual cycle, when the glands swell just like the lining of the uterus, but in the wrong location. Endometriosis is highly associated with infertility and irregular periods. The abnormal endometrial cells make estrogen just like fibroids. Therefore, they have aromatase enzyme activity, making estrogen and causing inflammation. Other sources of inflammation in the diet or in the gut can add to the problem. Fibroids associated with autoimmune problems and abnormal immune functions. We are not completely certain of all the causes and interactions of these connections. PMS, or premenstrual syndrome, is probably the most common of the estrogen imbalances we see. This is due to lack of progesterone in the second half of the cycle. Stress and inflammatory diets, lifestyle, and poor sleep are probably the most common causes of PMS. With PMS, we also see estrogen-dominant symptoms of breast tenderness, fluid retention, possible migraines, weight gain, irritability, and more. As mentioned previously, stress can steal progesterone to make cortisol. We also need cholesterol to make progesterone. I have seen women with inadequate cholesterol levels from being vegan or vegetarian for many years as a cause of very low progesterone and irregular menses. It depends on their body's ability to make cholesterol when it is not in their diet. This is the normal cycle showing the rise of progesterone from the ovaries, preparing the lining of the uterus for pregnancy each month. It is the drop in progesterone that causes the period to begin. So without the progesterone part of the cycle, the menses can be irregular and stop and start, or bleeding can be prolonged. The difficult part of treating PMS is that the second half of the cycle, when it is most important to avoid inflammatory foods and get regular sleep and exercise, is often when women are more likely to eat inflammatory foods and not exercise due to their symptoms. Once they start to make the changes to diet and find ways to improve sleep and stress, it definitely gets easier. The third type of hormone imbalance I would like to look at is polycystic ovaries. This is governed by complicated genetics. It is diagnosed by a combination of factors, including lack of ovulation, elevated LH-FSH ratio, high levels of testosterone, and an ultrasound of the ovaries often shows small ovarian follicles and may or may not show actual cysts. There is a high risk of infertility, obesity, and glucose intolerance with elevated insulin levels with polycystic ovarian syndrome. We also see excessive facial hair and acne from elevated testosterone. This problem worsens with excess estrogen from fat and stress. In terms of treatment for polycystic ovaries, successful weight loss is the most successful treatment in restoring normal ovulation. An anti-inflammatory diet combined with appropriate exercise is a key tool. 5-alpha reductase inhibitors block conversion of testosterone to DHT, or dihydrotestosterone, which is the cause of the hair growth and acne in polycystic ovaries. If you look back at the steroid pathways chart, you can see 5-alpha reductase as the gray arrow going from testosterone to DHT. This is the enzyme we would like to inhibit in polycystic ovaries. Medications may be needed. Birth control pills can increase serum hormone binding globulin, which binds testosterone. Metformin, a prescription medication for diabetes, can reduce insulin resistance and help with lack of ovulation. Progesterone is not necessarily helpful in polycystic ovaries. It could increase testosterone or estrogen. I've addressed polycystic ovary treatment here briefly, as it is a little different than the other estrogen-dominant conditions, but many of the treatment themes are the same. Reduce inflammation and use medication or supplements to optimize the hormone balance and pathways. Now we will go into detail about how the estrogen problems can be addressed in all these different areas. First, we will talk about how to make less estrogen and get rid of it more easily. Improving estrogen balance. One of my teachers made the analogy between healthy hormone balance and a ballroom dance. Everyone should have a partner. What we don't want is for estrogen molecules to flood the body and worsen fibroids, endometriosis, polycystic ovaries, and PMS. This also raises our risk for breast cancer, as we will discuss. When hormones are in balance, our cycles flow normally and inflammation is at a minimum. Next, we will discuss estrogen metabolism or chemistry within the body. The first thing we want to do when there is excess estrogen is to decrease production. We know that belly fat makes estrogen, and the aromatase enzyme makes estrogen from testosterone. Remember that turquoise arrow. So we want to decrease abdominal fat with healthy weight loss and decrease stress. We want to turn off the aromatase enzyme, which is where seams come in. Seams refer to selective estrogen enzyme modulators. And these are some of the compounds that will help decrease estrogen production by decreasing activity of aromatase enzyme. This includes green tea extracts, curcumin, EPA or omega-3 fish oil, isoflavones from flax, DIM, quercetin, and melatonin. In addition to decreasing aromatase, EPA, curcumin, and rosemary inhibit the COX-2 enzymes, which were increasing inflammation on the earlier slide. In addition to decreasing production, we want to increase detoxification of estrogen, help get it out. Think of this as taking out the garbage. There are two phases to liver detoxification of hormones, phase 1 and phase 2. These nutrients will support the different phases: flaxseed and DIM, or diindolylmethane, for phase 1, and B vitamins and methylation for phase 2. Here is an overview of how the liver detoxifies estrogen. We actually think of estrogen as a toxin. It needs to be eliminated when it is high. It is important for phase 1 and phase 2 of liver detoxification to be balanced. If phase 1 works more quickly than phase 2, we end up with intermediates in the red band that are more toxic and inflammatory than the original estrogen was. This is why methylated B vitamins and protein are so important. The protein supplies us with the amino acids needed for phase 2. So again, flax seeds and DIM, or diindolylmethane, a SEAM, can help improve phase 1 detox. Methylated B vitamins and protein can improve phase 2. It is important not to stimulate phase 1 without supporting phase 2, or you will actually increase inflammation. The next way to decrease estrogen is to increase excretion. It takes fiber and water to help the gut move out estrogens. Calcium D-glucarate inhibits an enzyme from bad gut bacteria that recirculates estrogen. Use probiotics and an anti-inflammatory diet to make sure you are having a daily bowel movement. Cruciferous vegetables give a natural aromatase inhibitor, or DIM, and fiber, a double plus. Carrots and cauliflower are the two vegetables that are highest in fiber. If constipation remains a problem, you may have undetected food sensitivities or overgrowth of yeast in the gut and need further testing. The last piece to think about for estrogen is to balance it with progesterone. We talked about progesterone not being inflammatory like estrogen and its importance for balance and correct cycling. The key issue here is to address stress and overall inflammation to allow the body to balance the hormones. Cautions with progesterone: look at the steroid pathway chart. Migraines and genetic estrogen issues, including COMT or methylation. We can gently stimulate progesterone with the maca herb or replace progesterone itself. We also use bioidentical progesterone via topical over-the-counter or compounded cream or oral prometrium. We check levels before and after, and we check estrogen levels as well to see the downstream effects of adding progesterone. Here, I would like to point out the 5-alpha reductase enzyme converting testosterone into DHT, or dihydrotestosterone. This is the light gray arrow below testosterone. DHT also causes hair loss, so 5-alpha reductase inhibitors like saw palmetto or black cohosh can help with hair thinning. How well any particular enzyme works depends on your genetics. Use of DHEA, the adrenal hormone, which increases testosterone, by women could also cause hair loss if they have elevated 5-alpha reductase enzymes genetically. This is where testing and working with your practitioner are very important. So we have talked about improving estrogen metabolism, and now we'll discuss how to reduce inflammation overall. We prescribe the anti-inflammatory diet and lifestyle to everyone at our office, with handouts that can be found on our website. This is a large theme at our office. This is a list of the most critical anti-inflammatory changes you can make. An anti-inflammatory diet avoids dairy, bad fats such as deep fried foods and refined sugar. An anti-inflammatory lifestyle includes regular exercise and high-quality sleep. We treat chronic infections and optimize gut health using probiotics and looking at the specifics of your food allergies or a need for specific digestive treatments. We treat obesity and insulin resistance. We treat stress and help you learn to decrease your triggers. We optimize vitamin D levels, omega-3 fat use, and methylated B vitamins and protein. We often supplement with curcumin and encourage the use of daily green tea for inflammation. We increase fiber in the diet, including flax, and test for iodine and inflammatory markers to assess your progress. Including resistance training in your exercise also helps to build muscle and fight the inflammatory cycle of weight gain. I have not gone into depth on iodine here. It does have an anti-inflammatory effect, and many people are deficient. It is especially helpful for breast health, but too much can be bad for the thyroid. Your practitioner can discuss this further with you. These are the tests we use the most to assess inflammation in the body. High-sensitive C-reactive protein often comes with a lipid profile or can be requested on its own. It has to be taken with a grain of salt because it can go up with the cold or any other type of trauma. Ferritin is a marker of iron storage. Hemoglobin A1C and insulin give us good markers for your ability to get rid of glucose. Vitamin D and iodine can be a blood spot or a 24-hour urine with a challenge. Lipid peroxide is on the Genova NutrAval organic acid test and is an excellent marker for overall stress. And Genova also makes a hormone panel, and we use specific hormone levels as well, and we'll be discussing that a little bit more. The third important area that can be used to balance hormones is that of genetics. Toxins are damaging our genes every day, and this can make it harder for the body to repair genes and keep them working properly. Specific genes, such as the COMT gene, can have variations that decrease our ability to get rid of estrogen. This can be modified by DIM, diindolylmethane, that was mentioned earlier. This is a close look at the estrogen pathways and different estrogens that occur. The COMT gene codes for the COMT enzyme represented by the pink arrow. The MT stands for methyltransferase, showing us how important a methylation of B vitamins is to provide methyl donors to allow this enzyme to work. We know that a high ratio between the 2-hydroxy and 16-hydroxy estrogens is associated with breast cancer. So helping the COMT enzyme work lowers the 2-hydroxy estrogen and decreases the risk of breast cancer. This is done by making sure you take methylated B vitamins if you do not methylate well as a genetic issue. This should be discussed further with your practitioner. Genes that affect estrogen. These are some of the genes that affect estrogen metabolism, and variations of these genes are very common. It is the combination of genes that can have a significant effect. Consider 23andMe testing. Our practitioners can advise about genetic counseling if risks for estrogen-related cancers are high based on your family history. There is also a test on the Genova NutrAval called 8-hydroxy-D6 that looks at the body's ability to repair DNA. We recommend either blood or serum or urine tests to look at your individual hormone balance. This slide refers to serum testing of the ratio between the 2-hydroxy and 16-hydroxy estrogens, which have some studies showing the recommended ratio for decreased risk of estrogen-related cancers. I use these tests as much as possible to make sure it is safe to use hormones over time and to look for the response to DIM and other treatments. This is the related test which we can use, as it also tests the 4-hydroxy estrogens in the urine. In summary, to improve the 2,16-hydroxy estrogen ratios, avoid obesity, avoid alcohol, eat cruciferous vegetables, which have natural DIM in them, eat flaxseed, use EPA or omega-3 fish oil, and there are additional supplements containing DIM. Around 300 milligrams per day is an oftenly recommended dose. These are 3 of the companies whose products we have used. Zymogen has the most potent DIM capsules I have found, and the others are on our Fullscript online ordering and are an excellent value for the dose and quality of the supplement. So now we have looked at each step of the vicious cycle that keeps estrogen, fat, and inflammation high. In summary, we want to help you get to a healthy weight and normalize insulin levels using an anti-inflammatory diet and exercise to stop this vicious cycle. Get adequate vitamin D and omega-3 fish oil or flax oil. Have your levels actually checked. Have your thyroid checked. Work on stress management and consider a trial of natural aromatase inhibitors. Avoid pesticides, toxic personal care products, and tap water. Consider daily green tea. Eliminate any areas of inflammation. We can help you assess your oral health, sinuses, gut, and urinary tract health. The other good news is that reduction of aromatase, inflammation, and excess estrogen is also good for the breasts and reduces risk of breast and other female cancers. My other final advice is to test, don't guess. Get your hormone levels checked before and after any treatments. Ask for markers of inflammation. Check your 2,16-hydroxy estrogen ratio if possible, and consider genetic testing with something like 23andMe to understand your risks. I hope this has helped you understand your path to healthy hormones and good hormone balance. Please consider our other group visits to help you with anti-inflammatory diet, optimal use of supplements, and exercise. We will be posting more of these on the website. Thank you.